My name is Srividya Kidambi. I'm an endocrinologist. I've been with Froedtert and Medical College of Wisconsin Health Network since 2008. I completed my medical school in India, and I completed my residency training in internal medicine at SUNY Buffalo, New York. And then subsequently I came to medical college for fellowship and then stayed here back as faculty. I see adults with endocrine problems, though I can see all conditions, but my specific interest is in diabetes, obesity, and lipid problems. So we call it collectively as metabolic syndrome. So these are chronic diseases, and my research also focuses on both obesity, hypertension, and diabetes, and therefore my clinical practice is aligned to what I study in my research as well. I realized how difficult it is for patients to manage these conditions. First of all, these are present once they start, they're present for lifelong. And again, there are many things that come together. So it's like almost, even though it seems like, oh, it's diabetes or weight problem or whatever, but there are many reasons why patients get that, and each person may require a different strategy to control that. So I really like teasing apart when I spend time with them. My initial visits are long, and I try to kind of learn about the patient, maybe a lot of it, why are you asking me all these questions? But as I tell my students, every question has a reason, and I'm formulating my plan. So I feel like at the end of the first visit, I feel like I know the patient and where the issues are coming from and how I can specifically address that. We have a huge team because, as I mentioned, these are multifactorial disease conditions, and I would like to offer our patients help wherever they need. Not every patient needs to see a dietitian, right? Not every patient needs to be on a medication. Not every patient needs to see an exercise therapist, but we have opportunity to work with all these people so we can create a specific plan for each of the patients who is having this condition. What I found joy really lately is that when I really do this thorough assessment and provide them that particular care, and as I take them off the medication, I think that's really is the best thing. And I would like the patients, my goal is, the patients to leave fewer medication than they came into me. So that's what I'm, trying to do. I have 3 children. All are, one is 11, but other 2 are teenagers now. So I like to spend time with them. They're fun to be around now that they are their own people. I also like to cook for my family. At least that's been one of my passions, is that I give them homemade food. So I do a lot of meal prep, and I really like cooking, actually. So I'm proud to say that we hardly eat out. And even my teenage boys like it. They say that their friends like to take their lunch and eat sometimes. So that's what I do.